All right, welcome everyone. Good afternoon. On behalf of the Cleveland Clinic Community Care, welcome to this special town hall, COVID-19 vaccinations and the Black community, where we will dive into vaccine hesitancy and equitable access in minority communities. My name is Alex Stokes, and I'm a reporter at Fox 8 News here in Cleveland. I'm also proud to be the granddaughter of the late Congressman Louis Stokes, who spent decades championing health equity. It is my pleasure to be a moderator for this program, and I thank the Cleveland Clinic for having me here today. And we want to thank you for joining us for this important conversation. We are also fortunate to have an excellent panel made up of experts and trusted voices in the Black community. All of them have received their vaccinations. We are joined by the Reverend Dr. Marvin McMickle, Pastor Emeritus and Interim Pastor at Antioch Baptist Church. Dr. Edgar B. Jackson, Jr., Chief of Staff Emeritus at University Hospitals of Cleveland and Executive in Residence at Cuyahoga Community College. Dr. Charles Modlin, Urologist and Executive Director of Cleveland Clinic's Minority Men's Health Center. Dr. Frederick Harris, Internal Medicine Specialist at South Pointe Hospital and Health Co-Chair for Ohio NAACP, and Dr. Melissa Leong, Medical Director of Cleveland Clinic's Medical Operations, which is leading the clinic's efforts in community COVID-19 testing and vaccine deployment. Thank you all for agreeing to participate in today's discussion. We look forward to hearing your expertise. At the end of the panelists' presentations, we will open up the forum for a question and answer session. So if you have any questions for our panelists, please type them in the chat box to be read and answered live. We will answer as many questions as time allows. This meeting is also going to be recorded, so it will be available later to view on the clinic's website and YouTube channel. To start today's forum, I would like to ask the Reverend Dr. McMickle to lead us in an interfaith prayer.
Thank you so much, Alex, and thanks to all the members of the panel for their participation. Thanks to the Cleveland Clinic for arranging this. We've been talking for some time about how to do outreach to the minority communities about COVID-19 vaccines, and I'm delighted to be a part of today's discussion. I want to begin by following the lead of our President, Joseph Biden, who led the nation in a moment of silence for the 500,000 persons, 500,000 persons who've already died from COVID-19. So before I read from Psalm 90, let us just pause for a moment of silence. Amen. Reading from Psalm 90 from the New International Version. Lord, you have been our dwelling place throughout all generations. Before the mountains were brought forth, or the earth and the world had been formed, from everlasting to everlasting, you are God. You turn men and women back to dust, saying, return to dust, O children of men. For 1,000 years in your sight are but as a day when it is past, and like a watch in the night. You sweep us away in the sleep of death. They're like the new grass of the morning. In the morning it springs up new, by evening it is dry and withered. We are consumed by your anger and terrified by your indignation. Make us glad, O God, for as many days as you have afflicted us, and for as many years as we have seen trouble. May your deeds be shown to your servants and your splendor to their children. May the favor of the Lord our God rest upon us and establish the work of our hands. Yes, Lord, establish the work of our hands. Amen.
Amen. Thank you, Reverend. Historically, minority communities have held a mistrust of our healthcare system due to decades of structural racism and misguided medical experiments, such as the Tuskegee syphilis study and Henrietta Lacks, to name a couple. According to a recent survey from the Kaiser Family Foundation, 35% of African Americans were reluctant to receive the COVID vaccine. Among the biggest concerns, 71% of those who responded were cautious of side effects. 50% worried that the vaccine would give them COVID-19, even though the vaccine does not contain the live virus. Now, we also know that the African American community is disproportionately affected by COVID-19. Recent data from the Centers for Disease Control and Prevention, or CDC, shows African Americans represent more than 12.2% of COVID-19 cases and account for more than 15.3% of COVID-19 deaths. To put that in perspective, African Americans make up roughly 13% of the total US population. Now, before we start our discussion, I'd like to take a look at the powerful story of Cleveland Clinic patient Tim Tyus. 5 days after being treated for COVID-19 and pneumonia, Tim says he felt the worst pain in his head he has ever endured. While recovering from COVID, he experienced a rare form of stroke. Here is his story.
I began to feel very nauseous and faint. And I said, well, let me go to urgent care. The symptoms got a little heavy for me. So the lady that was there that attended me, she said, are you okay? And I couldn't really respond fast enough to her. So she just automatically said, I'm calling 911. At home for a night, and I got up to take the garbage out. I couldn't hardly hold my head up, and my head was just all kind of pain. It was one of the most terrifying things I ever went through. I thought it was I thought it was the end for me, to be honest. People better take this serious. Wear masks and distance yourself as best you can.
We'd like to thank Tim for sharing his story. And we're glad he's doing all right, but his story is a reminder that we should all be deeply concerned about the health disparities we are seeing in the Black community, especially due to COVID-19, and create a stronger sense of urgency and understanding around the vaccination. So again, I want to thank my panelists for being here today. We are going to have a very informative discussion, and also in layman's terms, so that people really understand across the board how big of an issue COVID-19 is, and of course, really understand the education around the vaccine. First, Reverend McMickle, I want to start with you. You are leading a group of local brown and Black pastors who are trying to build confidence in the vaccine. What concerns are you and your colleagues hearing from community members, and how are you trying to address them?
Well, United Pastors in Mission, in partnership with the three major hospital systems in the greater Cleveland area, have actually been working together to try and address the very kinds of concerns that you raised at the beginning of this panel. That is to say, let's not let what happened with Tuskegee, where medicine was being withheld, from preventing folk from going forward to get the COVID-19 vaccine, where medicine is being provided. These are entirely different events. And we just want to give people the assurance that the vaccine is safe. Part of our discussion was with David Satcher, the former Surgeon General of the United States, who said to us that this is a very serious virus. He is much more concerned about the effects of the virus than he is about the effects or the side effects of the vaccine. So what we're doing today is exactly what our clergy group hoped would happen, that panels of experts would come, speak directly to the basis of any concern that persons have about taking the vaccine, the quality of the vaccine, the speed by which the vaccine was developed. Let's answer all of those questions with folks who are in a position to know, and because of their connection to our community, can speak with authority and trust. So Alex, thank you for hosting this. This is exactly what I hoped was going to happen. So thank you very much.
And thank you for your answer, Reverend. I just want to briefly follow up with, how imperative is it for faith leaders, community leaders to work in tandem with our medical professionals and healthcare systems to help that education, but also to break it down?
Yeah, when I was pastoring Antioch initially, we partnered with the Cleveland Clinic on another issue. We partnered with them on HIV and AIDS. They discovered that persons who had HIV and AIDS were not coming to the clinic to be tested, but they would come to the church because we were a trusted resource. So what happened was they provided the medical and scientific expertise. We provided the trusted environment and the assurance as persons they've come to know over the years as, shepherds who are trying to take care of all of the sheep. And so we want to stay in our lane. Our lane is to gather people together and give them our assurance that the voices you're going to hear from are both expert and trusted voices. Take their advice to heart. Believe me when I tell you that these physicians that they're going to hear from today can be trusted. They're going to tell you the truth. They will not sugarcoat anything for you, but they mean the best for you. And so I'm urging everybody to do what my wife and I have already done. Get both shots. Don't let anything stand in the way of doing it. And if you have any reservations, these people who are here today are going to put all that to rest.
Thank you so much, Reverend. Dr. Jackson, you have a reputation across the country as a minority health expert who has fought for equal health care for minorities over 40 years and served on the American Board of Internal Medicine and the National Academy of Medicine. What are your thoughts on the reluctance and access to the vaccine in the Black community?
Thank you very much, Alex. It's a joy to see you and to work with you and my colleagues on this panel. The vaccine hesitancy exists in all ethnic groups. It's more prevalent, though, in the Black community for good reason. As Pastor just pointed out, the Tuskegee experiment, but going back before that, the foundation of GYN, or gynecologic surgery, was founded on operations on our people in slavery without consent and without anesthesia. When you leave that brutality and come forward to the Tuskegee experiment, where Black men were fooled into thinking they were getting treatment when in fact they were just being studied, as recently as 1972, when that ended. In 1985, the United States government and organized medicine refused to admit that there were inequities in healthcare, that Blacks die younger and at a larger number than whites in this country. They refused to acknowledge that there was a difference in healthcare. So the Heckler Report that your grandfather had a lot to do with, the great Congressman Stokes, the Heckler Report was the first admission on the part of our government that there were inequities in healthcare. Then if you fast forward, the health establishment still didn't accept it. And until in 2002, the Institute of Medicine created a report at the request of the Congress. The Institute of Medicine serves as advisors to the Congress of the United States. Your grandfather and others demanded that the question be addressed as whether there are inequities in this country or not, so that organized medicine and the government would accept it. And in fact, that report is the first time medicine acknowledged that there were inequities in healthcare in our country. And then when on up, it didn't stop there. So as we get up to the modern times, some of my younger colleagues may comment on this today. There are still inequities in both access to care, the kind of care received, and so it has not yet gone away, though it is improving, and I'm glad to see that. So I think that the hesitancy in the Black community has been earned and is appropriate. The unfortunate thing is it hurts us the most. We're most at risk of dying from the COVID-19 infection. And now it's hard to trust the government that has not been trustworthy over the years. But it's critically important that we do, because it's killing us at an inordinate rate. And the misery of the disease, the death from the disease, says we absolutely should take the vaccine, which is safe and effective.
Thank you so much, Dr. Jackson, for sharing that with us. I'd also like to remind our audience, as we are kind of halfway through speaking with our panelists in this particular portion, to put your questions in the chat box. We will be getting to that question and answer session soon. So to follow up on what Dr. Jackson said, Dr. Modlin, I'd like to get your thoughts as well on the hesitancy from minority communities, especially the Black community, as we are talking about that today, also as they are often disproportionately affected by other types of diseases like diabetes that put them at higher risk for severe COVID symptoms. Dr. Modlin.
Yeah, there we go. I wanted to thank you, Alex, for hosting this event, Cleveland Clinic for allowing me to participate in this event. Actually, your grandfather, the great Congressman Stokes, was instrumental in allowing us to establish the Cleveland Clinic Minority Men's Health Fair and Minority Men's Health Center. I'd also like to recognize Dr. Edgar Jackson. Dr. Jackson's service to the community and advocacy opened doors for physicians like me to practice in Cleveland, Dr. Fred Harris and others. So we owe a great deal of gratitude for Dr. Jackson's leadership over the years. So yeah, there is a reluctancy with respect to minorities' willingness to take the COVID vaccine, but there is hope because a recent survey actually demonstrated that compared to back in October, there is a growing percentage of especially African Americans willing to accept the vaccine. I've seen an increasing number of individuals in my clinics and with whom I've interacted with trying to contact me to determine how they can actually expedite receiving the vaccine. So there is hope. One reason why African Americans really need to take this very seriously and get the vaccine is because COVID-19, the coronavirus, is disproportionately impacting African American communities and individuals. We contract COVID-19 at rates 5 times more than the majority population. We're hospitalized 3 times as often, and we're dying 2 to 3 times more often than the white population in the United States. So it's imperative that we take the vaccine. One reason why we are more susceptible to developing and dying from COVID, it's not because we're Black or African American. It's not, because we're a particular race. It's because we suffer more disproportionately from what we call social determinants of health. We have higher rates of chronic diseases. We live in certain situations, conditions that predispose us to poor health. We live in food deserts. We don't have jobs in many instances that allow us to social distance. We're frontlines workers. We have to take public transportation. We live in high density areas. And so these actually increase our predisposition towards developing COVID. So we have higher rates of diabetes, hypertension, heart disease, many types of cancers, again, which increase our susceptibility. So, you know, my wish is that, and hope is that we take this seriously. I will be first to say I don't have all the answers. None of us are saying that we have all the answers here, but we all have taken the vaccine. We've done well. We haven't suffered any ill consequences or side effects. Trust in the science. There were, in this particular, in the studies to develop the COVID and Moderna and Pfizer vaccines, 10% of the clinical trial participants were African Americans. Normally, clinical trials only have about 3% African Americans. So African Americans actually stepped up and participated in the clinical trials. That's very important because we know the safety and efficacy applies to African American populations. These vaccines are 95% safe or more than 95% safe. They're 95% efficacious, meaning that they protect us against the COVID-19 virus. And there were very few minimal side effects in the clinical trials. So I'm going to stop here and let other panelists comment.
And we'll certainly get back to a lot of things you touched upon, Dr. Modlin, and thank you for that answer. Dr. Harris, if you'd like to weigh in on this as well, I'd also like to note that the Vice President in an interview this week underscored the legitimate and historic reasons for hesitancy, but also pointed out that one of the doctors who was on the forefront of developing the vaccine is Dr. Kazmika Corbett, a Black woman. Dr. Harris, could you weigh in?
Yes. Thanks, Alex. Thanks, Cleveland Clinic, for having us. Thanks, community, for tuning in. I'm happy to report with the use of the current vaccines, we can end this pandemic. Also, we can never forget about public health measures as well. Number one, the currently available vaccine are both very safe and efficacious. Every decision we make in medicine is based on a risk-benefit ratio. Whether we're talking about diabetes medicine, high blood pressure, we make a decision together. In regards to making the decision to get the vaccine or not to get a vaccine, this is what we call a no-brainer. What I mean by that, what do you mean by that, Dr. Harris? Well, on one hand, we know the complications of COVID-19, that it can kill you, that it can make you very, very sick. It can cause end-stage disease in a lot of areas, including the lungs, the kidneys, and so forth. Even in people who don't get that sick, they get what's called long haulers symptoms, syndrome, where they have brain fog, fatigue, shortness of breath, palpitations. Things are never the same. On the other hand, we have a vaccine with very, very, very minimal side effects. So certainly, when you weigh the two, it certainly outstrips the decision to get the vaccine. We're talking about 500 people that will no longer show up for family reunion. We're talking about 500,000 people, that is, not 500, 500,000 people, 506,000 as of this morning, in fact. So we counter that with a vaccine that has very minimal side effects. By that, I mean maybe some arm soreness, some fatigue, some malaise, headache, what have you, but nothing lasts over 2 to 3 days. I got my vaccine and basically only ended up with a sore arm. This is pretty typical. When we say 95%, the two current vaccines have a 95% efficacy. The significance there is threefold. Number one is there's 95% you'll never get seriously ill from COVID. You'll never have a worry about 95% chance of not going to the hospital or not dying, provided you take the shot, of course. So the main thing, people come in now asking about the shot, the shingle shot, this other shot. I say the only shot important right now is the COVID shot. We have to get this shot so we can close these disparities. As they already have told you before, we live in areas where we have 5 times the rate of contracting the virus. In the Black and brown communities, we have 4 times the amount of hospitalizations and 2 to 3 times the death rate from COVID. We have hypertension, diabetes, obesity, heart disease, renal disease, lung disease, liver cancer, autoimmune disorder, sickle cell anemia, just to name a few. These conditions gives us 12 times the risk of dying from COVID. How do we counteract these odds? Very simple. Get the vaccine so we can equate, or I'll call it the equalizer. It allows us to close these disparities. So it's very important. I remember when I first got the shot, I couldn't wait. I waited the first week, they hadn't called me. The second week, I hadn't got a message. The clinic only has a limited supplies, does the rest of the world. I went out in search of them after about the third week, and within 2 days, I got my shot. I never felt better. I never felt safer. Here I am in the line of fire. I'm seeing patients every day. I'm going to the hospital, the emergency room, intensive care unit. I had to have that extra level of protection, and all I had to give up was maybe a sore arm. So we want everybody to get this vaccine and appreciate the value of this vaccine. It's really a medical miracle, this vaccine. This is our way out. This offers hope for all, but only if we take it. So this is our way out of this painful pandemic. Thank you.
Thank you so much, Dr. Harris. Dr. Leong, last to you, I'd like to wrap up by hearing your thoughts on vaccine hesitancy and why Black people and Americans should trust this vaccine despite hearing those buzzwords like warp speed.
So Alex, appreciate the question. I also appreciate the other panelists and their comments. In terms of their passion for the community, their eagerness, and their ferocious enthusiasm to protect us from COVID. In terms of the vaccine hesitancy, I've spoken to a number of my own patients as well as my own friends in many conversations regarding vaccine safety, regarding the science behind the mRNA vaccines, and trying to downplay the warp speed part of it to say that there is tried and true science behind the vaccine technology. And I think that despite some of those conversations, some of my friends did decline the vaccine. And I think that some people will need time to hear the facts, to absorb the science, and to trust that this is going to help them. But I do want to stress that we do not want to leave anyone behind. I think that the African Americans, as well as other minority groups, will be left behind if we don't get vaccinated soon. I think one of the things that the Cleveland Clinic, as well as the local health departments and other hospital systems have been working together for, is to really understand that equality does not equate to equity. So what do I mean by that? If African Americans are dying 3 to 4 times more than other groups, that doesn't mean that they should have an equal amount of vaccine. That actually means that we need to triple our efforts to vaccinate this community. And I mean that with all of my sincerity, because this is killing our community members. This is destroying their livelihoods. This is destroying their homes and their futures. And so the Cleveland Clinic, as well as the other hospital systems and the local health departments, are working together collaboratively and with 100% support from the state as well as community organizations to ensure that our community members can have access to the vaccine, can have the right information to make informed decisions about the vaccine. And so, I am emphatic about getting the vaccine out as quickly as possible to as many people as possible so that we can see this pandemic end. It will not end if we do not get vaccinated, if most of our communities do not get vaccinated. And this is really, just like what Dr. Harris said, this is our chance. And again, open to any questions that people have about the vaccine distribution. But again, we are making sure that there is equity for the vaccine distribution, and we are working harder to get our minorities vaccinated.
Thank you so much, Doctor. Thank you to all of our panelists for sharing your expert knowledge and resources to help educate us so we can make an informed and constructive decision about the COVID-19 vaccine. We're now at the interactive portion of the meeting and we have reserved about 30 minutes for this question and answer session. Again, please type your questions in the chat box. We'll read it and answer them live, and we will try to get through as many as time allows. I already have some up here. First, I just want to help break down, it's kind of a two-part answer or question and answer. Number one, can one of you just break down what the mRNA means, what that type of vaccine is. Is it something that is so new to the medical community, or is this something that we actually know a lot more about? And also, piggybacking on that, is there a particular vaccine, especially as we look at these other vaccines coming out, that people should, that is better than the other, or people should be weighing against each other? I'm not sure which one our panelists feel. If you want to raise your hand, I will come to you. Is that Dr. Modlin? Do you want to take that?
I think, yeah, Dr. Harris, I think, can take it. But basically, one of the take-home messages is that this messenger RNA, actually, there's been a lot of decades of research around this. But one thing I'll say before Dr. Harris is that you cannot contract COVID from messenger RNA, and there's a lot of suspicion and distrust and fear about that. So yeah, I'll let Dr. Harris make a comment.
Dr. Harris?
Yeah, the messenger RNA has been around since 1990, been around for decades, at least the technology that's associated with it. So in spite of the name warp speed, it hasn't been something that came up overnight. So that's number one. What it is when someone gets an injection, the way to think about it, the body, you inject some genetic material into a person's arm, and it sends messages to the body to make what's called a spike protein, that protruding spike, so to speak, off the edge of the coronavirus. And the body sees that spike and starts to develop antibodies and develop an immune response without using a live vaccine. So without using a live vaccine, it does not put people at risk of ever getting COVID. It does not go into the nucleus where the DNA does not mess with that nucleus whatsoever. So there's no DNA problems associated with that as whatsoever. The other thing is that people that are immunocompromised can use it. People on immunosuppressed can use it. People that are elderly and frail can use it with very, very limitations in not having the risk of what a live virus would do to you. But it has been around for many, many years. It's the messenger RNA is superb technology, and we think this is a novel.
And when you're weighing these different vaccines against each other, is there one that's better than the other? As people, try and consider, somebody did point out that there's a rumor that the Moderna vaccine is better for Black and brown people. Can you address those questions?
No, that's okay. No, they're equal. They're both efficacious. 95% in the studies. Pfizer did a study with 43,000 people. They came out with 95%. Moderna did a study with 30,000, which both of them had 10% Black minority representation, and it was 94.5. So they were, if anything, they were very, very equal with same amount of limited side effects.
Thank you so much. Dr. Leong, I want to go back to you. People are asking how they can get access to getting the vaccine. Some people are saying that in minority communities, especially in the urban areas, there may not be internet access. And so they're having difficult time scheduling for a vaccine online. Also saying, that they are in the age range for phase 1B, and yet they've seen their white acquaintances get the shot, but they haven't. So just kind of help direct people, if you could, to how you access and what the clinic is doing to try and improve access.
Thanks, Alex. So great question. I think one of the things to point out regarding vaccine access is that supply is the limiting factor. In terms of the number of vaccine doses that we have gotten from the federal government, what happens is that federal government assigns a certain number of vaccine doses to the states, and then the states then divvies that out to the counties based on population as well as COVID infection rates. And so Ohio it is one of the larger states, but it is not going to get the same amount of vaccine as California, New York, Texas, or Florida. And so we do get less doses than larger states. Cuyahoga County is the largest county in Ohio, one of the largest counties. And so we do get a good allocation in Cuyahoga County, but very small allocations in the surrounding counties because of the lower population. So in terms of the vaccine access, I will tell you that local vaccine providers, such as the local pharmacies, as well as some of our local health departments, only get 100 to 200 doses a week. At the Cleveland Clinic at main campus for Cuyahoga County, we've been getting about 2,000 doses a week. We have over 400,000 patients over the age of 65. So if we're only getting 2,000 doses of vaccine a week, you can figure that it'll take 4 years for us to vaccinate everybody over the age of 65. So the limiting factor is supply. Our local health departments are getting between 600 to 1,000 doses a week. As some of the newspapers have reported, there is no national stockpile. So there is no reserve of vaccine doses hidden somewhere. That has all been distributed. Current administration is working to secure more vaccine doses, and we will see an increased number in the vaccine allocation. And so I understand the anxiety around getting vaccine. If you are registered at local pharmacies as well as local health departments and hospital systems, you will be called when vaccine is available. So for the Cleveland Clinic, I will tell you, we started with age over 80 on January 18th. We are going age order. So as we go down in age, I will tell you that we are now, in the last week of February, and we are at age 75. Even though phase 1B has opened up to age 65 and over, as well as those with early childhood diseases, which are severe in terms of their severity. So again, we do not have enough vaccine to get to all those who are eligible in phase 1B right now, but we are going to get there. And I would say that whatever channel you have in order to get the vaccine, go ahead and do it. We do have, most of the hospital systems, as well as the community health centers, as well as the local pharmacies, have phone numbers in order to pre-register for the vaccine. And certainly at the Cleveland Clinic, if you are pre-registered with us, and if you've contacted us, or if you are a Cleveland Clinic patient, you will be notified when it is your turn to schedule for vaccine.
Thank you so much, Doctor. We have an audience member who wants to point out for anybody who needs it that the Cuyahoga County Public Library is a great resource for internet access, and staff can help with those technological needs. Also from that person, Reverend Dr. McMickle, this is for you. How can staff in other trusted organizations like public libraries, community centers, help bring forth the messaging on the importance of vaccinations for our community members of color? And with that too, we have someone else who was pointing out that their pastor is in chemotherapy for leukemia and will not be fully vaccinated, with the church considering reopening for Easter Sunday. So how do we also make sure that those community centers, centers of faith that are maintaining safety for those who are older, and of course anybody who's more susceptible to the virus?
Yeah. Most churches of any denomination are parts of larger networks and associations where guidance is being sent on a fairly regular basis. In my own case, American Baptist Churches, the Cleveland Baptist Association, United Pastors and Mission. So we're always sending out information to all of our member churches. I'm reasonably sure the same is true for all the denominations. Now, there could be some churches that are independent congregations, in which case I think that's where events like today and other televised programs, I don't think it's a question of whether or not people are aware of the virus or are aware of the vaccine. I think the only hesitation is it safe? Now, actually, I think a lot of people who were initially reluctant, including some clergy that I and Dr. Jackson know very well, were initially reluctant. They just wanted to see if I was going to survive. So they said, you go first, you get the vaccine, and if you walk around the next week, then I'm going to go get it. That's just what happened. I think those of us who are trusted, it's not just our voice folks are listening to, it's our example. If you do it and you have good results, that unlocks 10, 20, 30 more people to do it. So every time somebody gets the vaccine, they really owe it to somebody else to tell them. I've been vaccinated. I've had no real problems. Dr. Harris is exactly right. You might have a sore arm for a day, if that, but boy, that's a whole lot better than being dead forever. So I would just tell folks, if you've been vaccinated, tell folks about it and check the mail, because most churches are receiving information about what to do.
Thank you, Reverend. Dr. Jackson, I want to ask you a couple questions in terms of access. What is kind of the cost around the vaccine, if you can dispel any kind of confusion around that, as well as, you know, what are side effects looking like? If you can also touch upon side effects for the elderly population, if that's any different from any of the few side effects we see from the vaccine. Oh, and I think you're muted for a sec there. There you are.
Yes.
Thank you.
Thanks. First, Alex, I would just affirm, I think, what has been stated about the almost absence of side effects. Now, some people, it ranges. Some people get more side effects than others. But for example, I had none, except on the second shot. I had some arm soreness, as Dr. Harris and Pastor talked about. But in general, the risk of side effects are very, very small. And those individuals who think they may have a special risk, like they have allergies to lots of things, or bee stings make them sick, things like that, then the staff ask about that when they give you the injection, and they watch you over a period of time. If you're going to have a serious reaction, it'll be within 30 minutes. And so they keep you around to monitor you. So I would say it's virtually safe for anyone to take the vaccination. As far as access to the vaccination, that's been almost like an Easter egg hunt. It's hard to know who has them and when. There are emerging access points, however, to get on the list of people to receive the vaccine, which will now be available at various Walgreens, CVS, as well as the major hospitals, and a lot of churches. And it's my hope we will see more mobile vans getting out into the community. And I know that the clinic and UH are interested in doing that, providing greater access, and I'm sure Metro as well. So it's my hope that if you call a hospital, if you're unsure where to go, call the health department. It's better call Cuyahoga Health Department or the Ohio State Health Department and find out your access points. Get on the list, and whenever it's available, take it.
And can you expand? Do you mind speaking to the cost that might be associated?
The costs are zero to the patient. That's one of the advantages with the government buying it. It's of no cost to the recipient.
Well said. Thank you. Dr. Modlin, once somebody gets the vaccine, what is the CDC telling us that we still need to do afterward? This isn't a scot-free ticket just yet, is it?
I have to weigh the lights keep going out here. So yeah, once you get the vaccine, you know, it's not you have to get two doses, remember. And after you get the vaccine, you can't let your guard down. You still have to wear a mask. You still have to social distance, proper hand hygiene. Because again, we don't know how long the protection is going to last. You could actually potentially reacquire the COVID virus and be a carrier and spread it to other people. So you still have to take precautions and mitigate. I wanted to quickly give out a phone number where if people have a question about how they can access the waiting list or to get on the waiting list, 216-448-4117. That's the Cleveland Clinic COVID vaccine access line. You can call that number. I wanted to go back on something that Dr. Liang said about equity. as I said before, more African Americans than at any other time have stepped up to participate in the clinical trials to develop these vaccines. And in response, we actually, because of our participation, we expect to have equitable access. And there is something called a disadvantage index or a social vulnerability index that the CDC has developed. The federal government uses this index to determine how to provide resources during natural disasters, hurricanes, earthquakes, things like that. So the reason I mention that is because African Americans are more vulnerable. The CDC actually recommends that the individual states use this vulnerability index to determine which populations, a surrogate marker is zip codes, for example, are more vulnerable to acquiring COVID-19 and who have a greater urgency to be vaccinated. This index actually takes into account poverty levels, high density levels, transportation, things like that. And the state of Ohio actually has something called the Ohio Opportunity Index. So there are efforts being made to provide greater equitable access to minority populations. And in fact, the CDC recommends that each state reserve 10% of their limited supplies to these most vulnerable populations.
Thank you, Dr. Modlin. Dr. Harris, a question for you. Some people, are a little hesitant, obviously, as Dr. Jackson spoke to, with the side effects. Out of all the recipients who had documented adverse reactions, this person asked what percentage was African American.
Well, the African American has no more greater percentage of any side effect, namely sore arm, fever, chills, headache than anybody else. So it was pretty much consistent. And going back with this other question in terms of being vigilant with the public health measures is very important. It's three things. One, after getting the vaccine, it takes 2 weeks for the immunity to develop. That's why you got to continue to wear your mask, at least 2 weeks to develop protection. So you're not protected just when you get the shot. Number one. Number two, you can have COVID just before the shot or even just after the shot. In fact, I diagnosed a person that the other day. The temperature lasted over 3 days and that person was positive. So he had already had COVID brewing. So you got to continue to wear your mask, continue to be vigilant. Number two, we can still transmit and give the virus. You can still transmit it and give the virus, although to a lesser degree. Certainly, you don't have to worry about it as much, the person who's gotten the vaccine, because they're 95% protected. Then the third thing, until everybody hits what's called herd immunity, that's 80%. 80% of the population, until everybody kicks in, we basically at square zero.
Sorry, Dr. Harris, can you also quickly answer this question? With the different strains we're hearing about of COVID-19, somebody's asking, what does that mean for those of us who have been vaccinated, and do the current vaccines protect us?
Yeah, the current vaccines definitely protect us. There have not been zero person who has been vaccinated that had a breakthrough from a variant strain. So as of right now, the variants, that's what viruses do. They mutate. We expect that. So, but so far, so good. The Pfizer and Moderna vaccine covers all the variants in regards to severe disease and hospitalization.
Reverend McMickle, once the availability of the vaccine doses increases in Ohio, will there be an organized effort to host vaccinations at churches and faith institutions? And since clergy are highly trusted, can we set up vaccination stations in some church parking lots?
Yeah, there's not a church in any organization with which I am affiliated who has not already volunteered to be such a site if and when availability occurs. Here's my chief concern, Alex, and to the panel. After having spent so much time and effort urging people to get vaccinated, and having had all these experts tell us about the value of vaccination, I cannot tell you the frustration that I feel, and I think all of the doctors feel, in not having it readily available. So I think whatever we need to do to light a fire to get the numbers of vaccinations available. I don't think distribution is going to be the problem, at least not so far as churches are concerned. We've already signed up in a variety of ways to do that. But I am concerned that having raised people's consciousness about the value of it, they now have to wait and wonder about when they might have access. That for me is a real concern.
Dr. Leung, question about the ingredients of the vaccine, and also if any medications, prescription medications, over-the-counter medications would adversely react with the vaccine. One person asking specifically if there's any kind of gluten, dairy, lactose element in the vaccine as well.
Right. So in terms of the additives to the vaccine, so it is egg-free. So those who do have a history of egg allergy, you do not, it is safe for you to get the COVID vaccine because it is egg-free, latex-free, as well as preservative-free. In terms of, and I'm sorry, Alex, I'm going to need you to repeat the question. That was earlier.
That's all right. With prescription or over-the-counter medication, any adverse reactions?
Yes. Okay. So the recommendation has been to not take any medication before the vaccine, particularly anti-inflammatory. So what do I mean by that? Ibuprofen or aspirin. Because we don't want to block the immune system's response to the vaccine in terms of creating that immunity. Now, Tylenol, acetaminophen, is safe though, particularly after the shot. You may get the fever, the muscle aches, the sore arm. So we do tell folks that you can safely take acetaminophen or Tylenol afterwards, but we do not recommend folks to pre-treat before the vaccine.
I'll say one thing here also. The only contraindication to taking the vaccine is if you've had a previous allergic reaction or immediate hypersensitivity to receiving a vaccine in the past. Some of the ingredients that they feel could be responsible: polysorbate and polyethylene glycol. So, if you've had any immediate anaphylaxis or hypersensitivity to a previous inoculation, ask your physician whether or not it's safe for you to take the COVID-19 vaccine.
Thank you. Dr. Jackson, I want to talk about, many of our panelists have brought up the clinical trials, but right now we still are at a point where those under 16 cannot get the vaccine. And we also don't know data right now on pregnant or lactating women. Is there any data that we're starting to see on that? Any kind of clinical trials around that where we could get to a point of understanding if those populations are safe to get the vaccine?
Yeah, I think the data are emerging to support the vaccination during pregnancy. I do think that we do not yet have data about either the benefit or the safety of vaccinating children. Those under 16. There's no reason to suspect that would be a problem with them, but I'm not aware of any specific data that says under age 16. Yes, Dr. Harris.
Follow-up?
Yeah, in addition to that, the studies we should be out in this, they say in the fall for the 12 and over, the high school students, 12 and over. Hopefully by this fall, we have the information. Of course, it has to be vetted by the FDA in the spring for the elementary students. They still have a year to get to the trial. So we'll know by the high school students by this fall and by the spring as far as the elementary students. The studies will be done then, and then it has to walk up the FDA and the different panels, the independent panels for acceptance.
Thank you. And just to kind of wrap out, Dr. Jackson, I'm going to come back to you too. So do you want to finish that up? And then I have another question for you.
Yes, and the only thing I want us to, we talk about the vaccine so much, I think that people, we begin to de-emphasize the importance of mask wearing, social distances, and hand washing, and the other public health measures that will protect us. If we practice those things, both now and after the vaccinations, I think we will be a much safer nation.
And last question, Dr. Jackson, to you, but if anyone wants to quickly follow up, do we foresee having to get a booster shot for this vaccine?
Yeah, I think that's unknown at the moment, although while it's safe to get another vaccine later, it's unclear how long immunity lasts after we've been vaccinated. So I think it'll be time before we can answer that question.
Anyone else wanted to weigh in on that question?
I actually have, I'd like to,
Okay.
yeah, I'd like to make a comment about a word of caution. I've had a number of patients, and we've talked about it during this panel, that they say they want to sit on the sidelines and wait to see what happens. But the problem is, by sitting on the sidelines, you may lose your opportunity to get the vaccine. It may be many more months before, because of the limited supplies, when it's going to be available to you. The other thing I would urge people, if you're experiencing symptoms of other diseases, chest pain, shortness of breath, or you still need to see a physician and get worked up, because this COVID pandemic has actually resulted in a number of individuals not getting diagnosed with other serious life-threatening conditions. Now more than ever, there's an opportunity to see physicians virtually using telemedicine and stuff. So I would encourage people to continue to see their primary care physicians.
Right, and I can add to that as well. This pandemic has knocked 3 years off the Black man's life and 2.4 years off the Black female's life. So we're losing in this war. So we got to get vaccinated. As of this morning, we had 66.4 million people that has taken a vaccine. If somebody's been hesitant, want to look at a number, we've had 20 million people that's been fully vaccinated. So again, that's against 506,000 deaths. So again, this is a no-brainer. Line up, get that vaccine as soon as possible.
Thank you, Dr. Harris. Thank you to all of our panelists. We hope that the information they have shared today from these very trusted voices have helped you to make a decision about taking the vaccine when available to you, and stimulate conversations with those that you may have influence with. This vaccine will greatly reduce your risk of severe illness and death. Now, this is a great time of great uncertainty, but Cleveland Clinic's goal is always to arm you with tools and accurate information, and they are pleased to work hand in hand with you to help one another get through this unprecedented global crisis. The conversation does not end here. I know there's a lot of questions we didn't have time to get to, but we have a variety of virtual events that are going to be set up to answer community questions about the COVID-19 vaccine. Please look for future communications about those upcoming virtual events and webinars to help spread the word about these opportunities as well in your communities. A few of those include Let's Talk About It, that will be hosted by Cleveland Clinic Medina Hospital Thursday, March 11th from 6 to 7 p.m. Why Hispanics Should Get the COVID-19 Vaccine, a guide for families, on March 16th. There will be a session in both English and Spanish. And What Your Family Needs to Know, a fireside chat about the COVID-19 vaccine, also on March 16th. We would also like to let you know that Cleveland Clinic is now offering primary care services at their Langston Hughes Family Health and Education Center. That will be open to patients as well. Just giving you guys a quick look at that slide up there. And then just to wrap up this session today, which we really appreciate, again, our panelists for being part of, and you all for attending, we do encourage you to take a brief survey about this town hall. When you exit the Zoom session, there will be a web browser window that will open directly into the survey, and we hope you take a few minutes to provide some feedback. We'll also send out a follow-up email with a link to the survey and additional resources and information about the COVID-19 vaccine and upcoming virtual events. So thank you all for your engagement, participation, alliance, and commitment to keeping our communities safe. I'd like to take a moment to also thank our supporters, which you can see there on the screen, for helping us have this very important conversation. And now I'd like to ask the Reverend Dr. Marvin McMickle once again to close with a word of prayer.
Reading from Psalm 23 and reminding this audience that healing comes in two forms. It comes in the forms of medicine from those who wear the white coat, and it comes in the form of faith from those of us who wear a black coat. The Lord is my shepherd, I shall not want. He makes me to lie down in green pastures. He leads me beside quiet waters. He restores my soul. He guides me in the paths of righteousness for his name's sake. Even though I walk through the valley of the shadow of death, I will fear no evil, for you are with me. Your rod and your staff, they comfort me. You prepare a table before me in the presence of my enemies. You anoint my head with oil. My cup overflows. Surely goodness and mercy will follow me all the days of my life, and I will dwell in the house of the Lord forever. Amen.
Thank you, Reverend. Also, a big thank you to Dr. Adam Myers, Chief of Population Health, and Lisa Jackson, who manages the faith-based initiatives and helped to put this amazing session together. Thank you for your time. Thank you for being with us today. And please, everyone, stay safe and healthy.